Hi, it's Dr. Lisbeth Alter. Have you had your B12 levels measured lately? B12 is measured in the blood, and it's very important to have adequate amounts of B12 in your body. There may be several reasons for having low B12, and I'm going to read off a few of those reasons. One of them can be pancreatic insufficiency. In other words, your pancreas makes enzymes, and if your food isn't breaking down properly, you may not be able to absorb the B12. Another reason that most Americans have low B12 is that we end up taking many antacids, and this over time can make your stomach juice less acidic and therefore less able to break down foods and hence less absorption of B12. Patients who are vegan and or vegetarian can also have this issue because obviously they are not consuming animal products. So it's important that if you're vegan um, or vegetarian that you use supplemental B12. Another reason, which I call the happy hour syndrome, is some excessive alcohol intake. And specifically, as Americans, we tend to have all our alcohol consumption on the weekend. So this is a big drain of B12 on the body. If you have things like Crohn's or celiac disease, so these are diseases known as inflammatory bowel diseases, so the lining of the stomach and digestive tract in general isn't optimal, so you may not be absorbing B12 as well. And then patients who've had gastric bypass. Okay, so this is a surgery where your digestive tract is reconstructed, so part of your stomach is missing, and this may lead to an absorption or does lead to an absorption or lack of absorption of B12. And also, lastly, when you have dysbiosis or bad bacteria growing in your gut, as well as parasitic infections. So if the environment in your gut isn't favorable with probiotics, then B12 won't be absorbed as well. So remember, get your B12 levels checked and make sure that they are optimal and have a healthy day.